Have you ever thought about this? What if the cure for something actually causes a whole new problem? Well, that's what we're diving into today. This really tough paradox in medicine, where a treatment can save your life, but it comes with this hidden cost, a cost that can stick with you forever.
Okay, so picture this. You're fighting a really serious disease, but there's a treatment, and it gives you a real shot at a cure. Amazing, right? But what if that exact same treatment could also, permanently steal your hearing? And this isn't some what-if scenario. It's a reality for thousands and thousands of people every single year.
There's a medical term for this. It's called ototoxicity. It basically just means hearing damage, and sometimes even balance issues that are caused directly by a medication. And this side effect, it forces this almost impossible choice, right? Save your life or save one of your most fundamental senses.
And the scale of this problem, especially when you look at kids, it's staggering. Get this, as many as 60% of kids who get a common type of chemo end up with severe permanent hearing loss. Let that number sink in for a second. 60%. We're talking about a huge number of young lives that are just completely changed by the very thing that saved them.
So, you've got to be wondering, how is this even possible? How can a drug that's designed to heal us also cause this kind of specific, targeted harm? Well, let's dive into the science and figure that out.
Okay, so it really boils down to two main culprits. First up, you have platinum-based chemo drugs. You've probably heard of the big one, cisplatin. And then there's a class of super strong antibiotics called aminoglycosides, which are used for really nasty bacterial infections. Think of them as the heavy hitters, the workhorses of medicine. But they both carry this really serious risk.
Let's zoom in on cisplatin for a minute. This drug is, in many ways, a miracle worker. I mean, we're talking a 99% cure rate for some cancers. Incredible. But at the same time, it's pretty much the most ototoxic drug out there. And the way it works is by attacking these super delicate hair cells deep inside your inner ear. And those little cells? They're the ones that have the crucial job of turning sound waves into signals our brain can actually understand.
Now, this kind of damage isn't as simple as just turning down the volume on the world. It's actually a lot more insidious than that. It usually starts in the high frequencies, those sharp, crisp sounds like S or T. Those are the sounds that give speech its clarity, so when you start to lose them, trying to follow a conversation, especially in a place with any background noise, becomes almost impossible.
Okay, so if the damage is so sneaky at first, how in the world do doctors catch it before it's too late? Well, that's where this super important practice comes in. Ototoxicity monitoring. It's basically a system designed to be on high alert, listening for the absolute earliest signs of trouble. A good monitoring program is all about being proactive, not reactive. So here's how it works. It starts with getting a baseline hearing test before any treatment even begins. Then, hearing gets tested again right before each new cycle of the drug. If anything looks off, any significant change, they confirm it with another test within 24 hours, and bam, the medical team gets an alert. This gives them the info they need right away to maybe adjust the treatment.
But what does significant even mean? Well, this isn't just guesswork or a gut feeling. Audiologists are following really precise official guidelines. They're looking for a very specific, measurable drop in hearing at certain tones. And as soon as that line is crossed, it's like an official red flag goes up telling them, hey, damage is happening right now.
So, how do they actually listen for that red flag? They've got two main tools in their toolkit. The first one is pretty much what you'd expect, a super sensitive hearing test. You wear the headphones, you raise your hand when you hear a beep. It's great for catching those really early changes. But the second method is honestly fascinating. It's completely objective. A tiny little probe measures this faint echo that actually comes back out of the inner ear. The patient doesn't have to do anything, which, as you can imagine, is perfect for little kids or anyone who's just too sick for a regular test.
Okay, so monitoring is absolutely vital, no question. But what if we could stop the damage before it even starts? That's the holy grail, right? And the good news is we are actually entering a whole new era of hope with what are called protective therapies.
And this gets to the heart of all the new research. The goal here is absolutely not to weaken the life-saving cancer treatment. Not at all. It's about keeping that cure just as powerful as it's always been, but adding like a shield to protect the patient's hearing from being collateral damage.
And now we've got a major breakthrough to talk about. It's a drug called Pedmark, and it's been specifically FDA approved to prevent hearing loss from cisplatin.